Okay, it's the morning of the 27th, and it's May 27th, 2020. Now, this gentleman standing in front of you next to me had surgery yesterday, right?
Yep, yesterday.
Yesterday. And you're at Deuk Spine Institute?
Yes, sir.
And we had about 3,000 people watching your surgery yesterday. And we had somebody say, can you post a video of the patient tomorrow?
Okay.
So here we are.
Here we are.
We're going to post a video of you. So less than 24 hours after your surgery, and where have you been overnight?
I stayed home last night, very comfortable in my own house.
Yep.
It was very nice to do that. I had a private nurse with me for 12 hours monitoring me, and everything was great. It was nice to be at home.
No hospitalization.
Great not to be in the hospital.
And what surgery do we do for you?
I did a fuse on my bottom part of my neck, and the top of the neck, I had a bone pressing on my spinal cord, and the doc removed some
Lamina.
up there and put some pins in and released the pressure on it.
Yeah. So we went in the back of his neck. For those of you that watched the surgery, we made an incision, exposed the spine. We did a laminectomy at C3 and C4 with framenotomy, and then we did screws and rods down to T2. And how are you doing today?
Doing pretty good, considering I had that much trauma done to my neck. I'm up and walking and feeling pretty good. A little sore, but all in all, I feel very successful surgery.
Well, you brought up the trauma, and that's one of the things that we do different at Deuk Spine than most other spine surgeons, is we minimize the amount of trauma to the muscles and soft tissues while they do the surgery, and that's one of the reasons the patients can go home, is because of my techniques that I use that are different than most other surgeons. Now, before surgery, you had pain shooting into your arms, right? From your neck?
Yes, sir.
Is that still there?
No, not this morning.
It's gone. You have some numbness. Numbness
Yes,
takes about 3 to 6 months to go away,
Yep.
usually when we unpinch the nerve, so that's not surprising to me. Anything else you want to say to the rest of the world?
I just this was a great surgery, and I feel very confident in the doctor, and I'm glad I came down here. Thank you,
We'll
doctor.
see you next week to get your staples out.
Yes, sir.
Okay.